Mhm.
All right, hi everyone. My name is Tony. I'm the founder of August Society, and we make sustainable swimwear for the whole family. So today we're going to be talking all about sun protection. And joining me today is Dr. Shanna Ng from the dermatology practice. So she is a Ministry of Health-accredited dermatologist, and she's going to be sharing her expertise with us today. So Dr. Shanna, thank you so much for joining us and talking
No,
to us
thank you, Tony,
today.
for having me. Thank you.
Great. So sun protection is such an important topic, I think, to a lot of us living in Singapore, especially because we're on the equator. It's sunny and hot all the time. And, we don't just get sun exposure from outdoor activities, but also from just, walking to the MRT or going to the store, right? It's always there.
Absolutely, absolutely.
Right.
That's
So
right.
why is why is sun protection so important?
Yes. So, Tony, you're absolutely right. There's just a little bit of sun exposure here and there, that we get usually from even, say, going to the market or even when we are cooking next to like a huge window.
Mhm.
So sun protection is important to prevent, importantly, skin cancer, and also, of course, what women are and nowadays men are also more concerned about, which is skin aging. Yes.
Yes, no, very important. So I know also vitamin D is important as well, right? And we get vitamin D
Right.
from the
That's
sun,
right.
right? So how do we
That's
balance
right.
these two important factors?
Absolutely. So vitamin D, now we know a lot about what it contributes to our body. But sun exposure is certainly required to convert cholesterol to vitamin D3, and then this is later converted in the liver and then in the kidneys to an active form of vitamin D known as calcitriol. And so calcitriol is important in maintaining not only our bone health, but now we do know that it also helps to maintain our mental health, which is very important now.
Yes.
And also help, and it also benefits our immune system, our colon, and also possibly even prevent diabetes and high blood
Wow.
pressure.
Wow, that's a
Yeah,
lot. I didn't even realize,
yeah,
right? I thought it
yeah,
was just
that's
for
right,
bones
that's
and all of
right,
that, right? Yeah.
that's right, that's right, yeah. Mm. So,
Right.
but compared to what our hunter and gatherer predecessors used to do, right? Go out in the sun all the time. They used to get a lot of vitamin D naturally that way. I mean, nowadays, the benefit these days is that we can easily obtain vitamin D through fortified foods, such as like fortified juices, cereals, and also in fatty fishes such as like salmon, tuna as well. And then if you're a vegetarian, you can also get your vitamin D levels from vegetables such as spinach, kale, or even like soybeans, for example.
Okay.
Yeah.
Great. So
Mm,
then we can get it from other sources. And then how much
right.
sun exposure do we really need to maintain a good level of vitamin D?
That's right. That's right. So Tony, that's a question that a lot of people have been trying to answer, and the truth is that it's hard to determine because the research studies have all been very heterogeneous. That means there's no uniformity. Because there's so many variable factors such as skin color, a person's lifestyle, dietary habits, and also country of residence. So a study in the UK, which of course is a different different part from us, which has different seasons and also different types of
Mhm.
skin types there as well, right? The study actually showed that we only need around 9 minutes of lunchtime sun exposure in someone who is of a fair skin type, and around 25 minutes of lunchtime exposure in a darker skin type to get adequate amounts of vitamin D. So
Okay, so that's actually
really
not
not
so
so much,
much. Yeah.
not so much at all, Tony. That's right. That's right. But of great importance is that the studies have also shown that application of sunscreen doesn't actually reduce our vitamin D. So it
Oh,
doesn't actually
really?
contribute to vitamin D deficiency. So
Okay.
that's a very important piece of information to get out there. That sunscreen is still extremely important, and there's no downside to using sunscreen from that aspect.
Okay,
Mm,
great.
yeah,
And
yeah.
so, so we're talking about sunscreen now. So what's the best way to actually protect our skin from the sun? Is it sunscreen, or should we be using like physical barriers like clothing and hats and that kind of thing?
That's right. Yeah. So when you have kids, right? Of course, it's difficult So, in a practical aspect, when it comes to kids, it's always quite difficult to reapply the sunscreen or remember even to use or bring along our sunscreen, right? Because there's so much else to pack along in our bags,
exactly.
right?
Or to get them to
Yeah,
put it on properly, right? Yes.
Exactly. And when the kids are having fun in the water, it's so hard to like call them back and reapply the sunscreen again. But so therefore, the most important thing actually is, nothing beats avoidance of the sun, especially from 10 to 2 p.m. So you can always choose your water activity or any form of sports, before that or after that sort of timing. So avoidance is still the key. But if need be, you can always plan your activities in the shade. So you can be outdoors, right? But choose to seek the shade as well. Secondly, of course, if one has to or one enjoys a lot of activities out in the sun, then do use some protective clothing that are tightly woven and that have UPF, which is UV protection factor that filter out the sun. If possible, always have on a broad-rimmed hat to protect the face. The ears and the scalp especially, they get forgotten. So, to always wear a hat for those sort of areas where you can't actually put sunscreen over your scalp, right?
Yes.
So to wear a hat. And also, if one does water sports, then to consider rash guards for added protection. So if you see me out in the beach, right, you will see this short little lady wearing a broad-rimmed hat, and I'll be covered from head to toe, literally. So I have a rash guard that's covering all the way down to my wrist, and then one that covers up to my ankles. Yeah, so that's me. So that's me in the sun.
Right. But prevention is the best way, right? So
that's right. Prevention and protection. That's right. That's right.
Yes. Okay, so what's the difference between UVA and UVB rays from the sun, and what should we look for when we're looking for a sunscreen to protect us from them?
Mm-hmm. Yes, Tony. So the difference with the two is that UVA actually has a longer wavelength, and so UVA is responsible for the immediate skin tanning that we may see, and then also this then leads to skin damage and of course skin aging. This is as opposed to UVB, which has a shorter wavelength, and as such it actually causes a lot of the redness that we get from under the sun. And with this redness, there is delayed skin burns and delayed tanning. And the difference between the two is that actually a large part of our sun exposure is actually due to UVA. So 95% of our sun UV rays are actually UVA and 5% are UVB. And importantly, UVA is the one that passes through our glass windows, and UVB is actually blocked by our glass windows. Yes.
And so even on an overcast day, right, you still get UVA rays that come through. And
absolutely right. In fact, more UVA than UVB. Yeah. So the thing is that when we look for sunscreen, we always look for the highest numbers, right? But the thing is that with what actually happens is that by the time the SPF reaches about 30, then the protection level actually plateaus, such that when you use so that's right. So when you use a SPF of 30, you're actually you're actually blocking out 97% of the sun rays, and when it increases to a SPF of 50, then you actually only block out about 98% of our sun rays. So the truth is that one can actually not really get the added protection from even beyond SPF of 50. So that there isn't actually a SPF 100. But sometimes you do. I mean, if you go to other countries and then you go to their stores, you might see SPF 120, for example. Yeah, but the truth is that the added protection beyond that really plateaus off. So a sunscreen of a SPF 30 would be good enough to protect 97%. And SPF of 50, about 98% of our sun rays will not reach our skin.
Okay, so actually, if you go beyond that,
SPF is that it only tells us protection. Yeah.
Oh, sorry.
Yeah,
no, I was just going to say, so
it
doesn't do anything, and you might even get a false sense of security, even, right? If it's like you think, oh, I'm super protected,
that's
right?
That's right. That's right. Good thing to point out. That's right. And of course, the SPF factor only tells us the protection against UVB. Right, and remember what I said, Tony, earlier on, that actually 95% of our UV rays are UVA. Right. So so then how do we protect ourselves against UVA? So we look for the plus sign after the SPF number. So the highest plus number would be 4+. So this will tell us our protection against UVA. Yeah.
Okay, great.
Mm,
All
yeah.
right, so I think for all of us, as we mentioned, we all want to look
Yes.
younger, right? And so what
Yes,
are the
yes, that's right.
signs? Yeah, what are the signs of sun damage, and what are the best ways to treat it? So this is if, for example, we've gone beyond prevention and now we've seen the signs
Yes.
of damage. How, like, what can we do to rectify it?
Yes, that's right. So certainly we all want to look younger. And sun damaged skin would most certainly make one look older than our actual age. So what happens with a lot of sun exposures in the early stages, you may first notice sunspots. These brown spots on the cheeks or all the other sun exposed areas for your forearms, your wrists, and your legs. Then you will also notice that the skin starts to get quite rough and dry easily. Further down the timeline, one may notice more obvious blood vessels around these sun-exposed areas of the face, even the chest, the ears as well. And then there's also loss of elasticity, so you'll see more wrinkles that are usually deeper than what you would see in your actual age. Yeah.
Okay.
So in terms of the treatments, there are many treatments available. There's like over-the-counter treatments for these, and then of course prescription treatments for these. These come in the form of applications, lasers, and of course injectables as well. So in terms of the applications, there are like retinoids, vitamin C, and hyaluronic acid. So for topical retinoids, there are over-the-counter strengths or prescription strengths. With hyaluronic acid, you can find them in like application topicals, or even in injectables, so like skin booster injections. And then the last thing would be lasers. So lasers we do for maintenance. So sometimes once every 2-3 months, or like once every 6 months, just to maintain both the pigmentation and also to help with like the blood vessels that form under the skin, and also sometimes for fine lines and open pores as well. Yeah.
Okay, that's interesting. All right.
Yes.
And then now let's talk about the big C word, right? Skin cancer. And
That's
so
right.
are
Yes,
some
yes.
people really more susceptible to it, based on your skin tone or your ethnicity? And also, what should we look out for, and how do we know when we need to seek professional help?
Yes, that's right. So the big C word is very, very, very important to look out for. If one is fairer, of a lighter skin type, and may burn or tan more easily, then certainly that puts that person at higher risk of skin cancer. So we usually say that cumulative sun exposure, so the frequency and the number of hours of sun exposure leads to a form of skin cancer known as basal cell carcinoma and also squamous cell carcinoma. Whereas the intermittent or sunburns that one gets would increase the risk of melanoma. So, your skin type is very important, and also whether you tend to burn or tan more easily is quite important. And of course, the amount of time that you spend under the sun is very important. If one actually has pre-existing moles or starts to develop multiple moles and has a positive family history, and there are also certain genetic conditions, and if the immune system is sort of suppressed for many reasons, whether it's an underlying medical condition or whether one is on medications, then this would put that person at a higher risk of developing skin cancers.
Okay.
Yeah. So Tony, you asked about what to look out for, and at what point should they consult the doctor. So one should really hopefully have somebody to become familiar with their moles in certain areas where self-surveillance is difficult, so such as on the back or even on the scalp. So a partner who will be able to just monitor that periodically for you and get familiar with how it actually looks would be most helpful. Frequently we have like the husband or the wife that actually tells the partner to come in for a skin check because they notice that something has started to change. So to have a reliable partner would be actually very important. Otherwise, one can certainly try to survey and get familiar with the moles. If they change in any size, shape, color, they become itchy or they bleed, then do present early. The most formal way to assess them, of course, would be to see your dermatologist. but nowadays a lot of information is very widely available on the internet. So do look out for the ABCDE, which you can find on the internet. If not, you can go to the American Academy of Dermatology, and there's a lot of information there, or the British Association of Dermatology. There's a lot of patient information on those websites. And what ABCDE stands for is A stands for asymmetry, B stands for any change in the border or irregularity in the border. Color would stand for color, and color would mean like more than one color or any variation in color. Then this would actually this would actually be important to bring to a doctor's attention. Then D would stand for diameter. Usually would say more than 6 millimeters, but certainly if there's anything that's evolving, then do come earlier. Yeah.
Okay, because the earlier the better, I assume. Yeah.
Earlier the better. That's right. Any change in any of your moles, just to come and see it. But because my subspecialty is in children, so I must make a mention that in children the mole checks will be quite different. So the ABCD is modified in children. The A would actually mean amelanotic. Amelanotic just means that the pigment is being lost. So you might see a brown mole losing its color or turning red. Then it's quite important to bring it to a doctor's attention. The B in a child would mean bleeding or any bump. So a flat mole that has become more bumpy would need to be brought to medical attention as well. And then C in children would mean color uniformity. So in the children, the color in the mole may not be varied. It might be in a uniform kind of like color. And D would be any de novo change or just any change at all, as you said, Tony. So any change in your mole. Any change.
Yes. Okay. Yeah. And then, and skin cancer actually can hit at any age, right? It's not necessarily for older people, or, I mean, it's probably more common, but it's a possibility in children as well, right?
That's right. That's right. You're absolutely right, Tony. So it's less common in children, but depending on one's family history, one's skin type, whether there's any underlying genetic condition, or sometimes long-term medications, for example, like if they've had a transplant and they're on immunosuppressants to prevent transplant rejection, then that would of course increase that child's risk of developing skin cancer.
Okay, great. That's important to know, right? As parents, I think we always want to know what we can do to protect our children more, right? So
that's right. Of course, yes.
Okay, well,
having more information is always better.
Yes, exactly, right? The more that we know. Okay, well, thank you so much for sharing all of this important information with us. So I definitely learned a lot about how I can protect myself and my family from, sun protection, and how, we can get important things like vitamin D as well, right? In the, even while we're doing it. So if any of you have any burning questions for Dr. Shanna, just go ahead and leave them in the comments, and then we can collate them and then ask her afterwards, and to get some answers for you as well. So thank you everyone for watching, and stay safe and take care. We'll see you next time. All right, bye-bye.